Hi there. I wanted to make this video because there were some things that I wasn't aware of that went on in the hospital. Just things that happened after surgery that I wasn't quite sure I wasn't expecting. And I just wanted to do this so that other people out there would be informed that are still planning on having this done, that haven't had it done yet. Let's see. Maybe I didn't watch enough videos of post-op people, but I wasn't aware of how much actual pain there is, like in my stomach itself. I mean, I should have known considering how many staples are used in your stomach itself. But I also had an injury on my neck, so my upper back, I found out I had arthritis in it, and my neck pain is it's activated my arthritis pain in my neck, my back. So when I had this surgery, I was already on narcotics for the pain, and it didn't quite, having this surgery didn't quite help that. So I've had to actually be on quite a few different pain medications just to keep myself from being in that much pain. So I wasn't aware of how it was going to be. It may just be me, I don't know. But last night I woke up after about 6 hours of sleeping, and I was hurting really bad. I did feel pain. It was mainly in my back, but I took my Roxaset, which is it's Percocet, liquid Percocet that they gave me. I took some of that and laid back down, and I was actually able to find a way to lay on my side, just because laying on my back kind of gets monotonous, and just for a little bit more comfort, I laid on my side for a little bit. But I found that it only worked comfortably if I put like a blanket underneath my stomach on that side, so that it would have something to rest on instead of having gravity pull it all the way to the bed. So if you want to lay on your side, that is possible to do. Just have something there to kind of support your stomach. It's also hard laying on my back since I've been at home, because in the hospital they have the beds where you can, angle the bed. So I was actually I wasn't completely flat when I slept in the hospital. I laid, at a slight angle. So if you can find a way to do that at home, once you come home, that will make things more comfortable as well. They did give me a wrap for my stomach that kind of compresses things, and it helps hold it in. That way your stomach muscles aren't having to do all the work to hold your stomach in place, because it is a lot of strain to do that on your own. So I don't know if all hospitals do it, but they had quite a few on hand there. Just if they don't, maybe you can ask for one, because it does help with the pain while you're actually in the hospital. It's I don't know, they call it a wrap of some sort. It's Velcro, and it's about, that high, from top to bottom. There's that one of it, and there's one that's a little bit bigger too. They put that on me while I was still in the surgery room after they actually performed the surgery. They put that on me, and it did feel a lot better, not having my stomach just out there and my muscles having to do all the work. So I actually slept without it last night, and this morning that's when I realized, what it really did, because my stomach muscles hurt. So I put it back on after I took my shower, which was exhausting. I just took a shower the normal way I always did, and I was so tired afterwards that after I got dressed, I came downstairs, got my wrap on, and then I zonked out for I don't know how long, but still I was tired. I just couldn't keep my eyes open. It was that exhausting to take a shower. So be expecting something like that. But I did just come home from the hospital yesterday, and Not everybody just gets in the shower the next day. So, some of the things that happened in the hospital was I got bad headaches. I don't think it was from caffeine withdrawal because I hadn't had any coffee, or of any coffee was the only thing I drank for caffeine, and I hadn't had any since Friday, and my surgery was on Monday, and I hadn't had any headaches at all that weekend. So I don't know what caused the headache, but it was debilitating. It was so bad I had to put a cold cloth on my head and sleep it off. They did give me Toradol, which is a amped up ibuprofen. They gave it to me in my IV. I did call my doctor, and they prescribed me some because I guess just because that's what they gave me in the hospital. I don't know, but I have to go pick that up because I called them today. So I did get a headache today, and I didn't know what I was supposed to take for it. The other things that they gave me were Prilosec because of my acid reflux. It was pretty bad every time I tried to take any kind of anything that I had to swallow. It would give me indigestion. The gas is so extreme. I know they said that there's going to be gas after surgery, but I did not expect it to be this intense. I mean, not only it comes out all ends, sorry to say, but every time now, even I eat something, every time I take a bite, I feel gas, and even the tiniest little burp helps relieve that because I get air bubbles or something every time I take a bite, and I do eat slow, so it's something new for me. I've never had that issue really. I had GERD at one point, but I haven't had that in years. But just from eating, I have not had issues with gas, and having that when I came home was very painful because it felt like my chest was on fire. It would tighten up really tight, but then I'd feel the little air bubble coming back up, and it'd be a tiniest little burp, and it would just be gone. So just be aware of that. They do ask you in the hospital about that too. So, but they're speaking of a different type of gas. But there is a lot of it, and just be aware that it's normal and it will happen, and the sooner it happens, the better. My video is getting kind of long, so I want to kind of just tell you a few other things. The drainage tube that was inside that I've mentioned plenty of times, that caused a lot of pain, and I had to have it in until the moment I was released. And let's see, the tube that was inside was about this long. And when they took it out, they just pulled it out really quick, which I would rather have had anyway, because get the pain over with, and it's done. So just beware when you have that tube pulled out, it's going to hurt, but just grin and bear it, and before you know it, it'll be over with, if you can get the nurse to do it really fast. But it was painful because I couldn't breathe. It was sitting inside my chest cavity, and, I know it was needed, but I was glad it was gone because breathing in, it feels so much better now that that tube's gone. And you're supposed to make yourself breathe deep so that you don't get pneumonia. But just know that once that tube is gone, it will be a lot better because it won't be so painful. But another thing that I was not aware of is when you have surgery like this, your blood sugars go up. And so when they were testing my blood sugars and they were in the 200s, I was shocked because I've never had diabetes. I'm not diabetic at all. My blood sugars normally run in the 90s. And they poked my finger so many times because they were checking me like twice a shift. And so I got insulin shots. If my blood sugars were over 100, they were giving me insulin shots. So I got them quite a bit. Only one time was it under 100, it got down to 99. But just be aware, I don't know if your hospital or your doctors will do that, but mine did, and I wasn't aware of that. I wasn't expecting that. So, let's see. The medicines I'm taking now, I did buy the Centrum chewables, and they were disgusting. They're huge and they're just gross. So I took them back and got some chewable gummies. That tastes so much better. So if you can avoid Centrum chewables, they're huge and they're gross. Go with the gummies. They will, I can guarantee they will taste a lot better. B12 that I got at Walmart, the 2,500 milligrams that I have to take once a week. They're sublingual, but you just put it in your mouth and you suck on it and it just melts away. And it was cherry and it tasted really good. So I enjoyed that one. The Roxaset that they prescribed for me is like a very thick cough syrup, and I found it disgusting. So I always had to have something on hand to chase it with. So be aware if they give you that to have something in hand, even broth at the hospital. I had that to cover up the taste, because it's gross. Cold items I have a real problem drinking. My protein shake took me like 3.5 hours to drink this morning. It was cold to begin with, and that really hurts my stomach right now. So I'm hoping that will get better in time, because I don't want to have to take 4 hours to eat my breakfast. That, I think, well, I'm not hungry. My stomach rumbles a lot from the gases and whatnot that are moving around in there, but I'm not hungry. I don't feel hunger pain, but I still have to eat my 3 meals. And that's about all I can think of. Oh, I was down this morning to 305.3. So it's showing already, but I'm not sure how much that is gonna stay like that or not, or if it was just water weight, or the fact that I weighed myself yesterday at night is why it was 5 pounds heavier. But I'm just gonna keep a positive mind and hope that this video helps everybody, because if I would have come across a video like this, I would have been really happy to know some of these things, so I knew what to expect. So I hope this helps you, and I will see you later, and I hope this does some good for somebody. See ya.